Over the past few weeks, we've been actively engaged with frontline partners, hospitals, long-term care, and union leadership, and our best experts to identify concrete and actionable solutions to respond to urgent pressures, as well as prepare for any expected surge in the winter months. The second phase of the plan to stay open we are introducing today is the culmination of those conversations. Our goal is clear: provide the best care possible to patients and residents while ensuring the resources and supports are in place to keep our province and our economy open. The plan will also free up and make available over 2,500 more hospital beds on top of the 3,500 the province has so far added, so that care is there for those who need it and the province can stay open during an expected winter surge. We are working with the college to reduce financial barriers that may be stopping some retired or internationally trained nurses from receiving accreditation to resume or begin practicing by temporarily covering the cost of examination, application, and registration fees.
That's why, to support the stability and recovery of our health system, we're moving on a suite of permanent changes that will ensure Ontarians are getting the right care in the right place. Some of the measures include investing $37 million this year and $62 million annually going forward to expand access to a range of services and supports for long-term care residents with more complex needs like bariatric, behavioral, and dialysis. Freeing up over 1,000 long-term care isolation beds for regular use to help reduce the long-term care waitlist. Reintroducing short-stay respite and convalescent care beds in long-term care to support patients in an appropriate care setting. Now, as part of this suite of actions, I'm proposing amendments to the Long-Term Care Act later today. No one wants to stay in a hospital longer than they have to. However, there are unfortunately those patients who doctors say no longer need to be in a hospital, but can't go home either because they require additional care. These amendments, if passed, will make it easier to temporarily transition these patients into a long-term care home where they can receive more appropriate care in a more comfortable setting while they wait for a bed available at their preferred home. We're going to be consulting with agencies and our frontline partners on a consistent placement guideline that will ensure patients continue to stay close to their partner, spouse, loved ones, and friends.
As the actions in this plan are implemented, Ontarians can expect to see faster access to health care, including lower wait times in emergency departments, lower wait times for surgical procedures, and more care options in our communities.